Thank you for joining us for today's Ipsos Know the New America webinar with our focus on the importance of public health research. Throughout today's session, you will remain in listen-only mode. However, throughout the webinar, you may submit questions online using the Q&A feature. Time permitting, we'll answer your questions at the end of today's session. However, if time runs short, then your question will be answered by email. Today's webinar is also being recorded and will be directly emailed to you. So now, without further ado, it is my pleasure to welcome today's first speaker, John Bursler, Executive Vice President of Ipsos Public Sector Research. John, you have the floor.
Thanks so much, Ellen, and howdy everybody. Welcome to our webinar. We're very excited to talk about the importance of public health research, and I'm really excited to be joined by two amazing experts. So we have Mallory Newell from Ipsos Public Affairs and Rashi Romanoff from NAVREF. So thank you both for joining. Just before we get started with our formal presentations and then more into the discussion and Q&A portion, Mallory and Rashi, I'd love for you both to do a quick intro for the folks that have joined here, and then we'll go straight into it. Mallory, over to you.
Great, thanks, John. Hi, everyone. Thanks so much for joining us today. I'm Mallory Newell. I'm a VP at Ipsos Public Affairs. I work closely with John, and I am one of the leads of our public polling practice. So hopefully anytime you see Ipsos in the news, that's part of the research that me and my team do. Today, I'm here to kind of shine a light on public opinion as it relates to public health, the broad umbrella term that public health is, and to just showcase where Americans are on current policy proposals, how they feel about their own health and well-being, who they trust in this space, just to kind of set the stage for the discussion. So happy to be here.
And Rashi, over to you.
Thanks so much to Ipsos for having this great webinar and for inviting me to be a part of it. My name is Rashi Romanoff. I am the CEO of NAVREF, which is the National Association for Veterans Research and Education Foundations. It might also win for potentially longest acronym for an organization. We're a nonprofit that is dedicated to expanding the clinical research trial opportunities across the VA. Really excited to be here, to sort of borrow from Mallory's metaphor around the umbrella of public health research. I'm excited to share a little bit of the sliver of the umbrella that the VA is really a part of, and some of the innovation and research around public health that the VA drives. So looking forward to the discussion.
Awesome. No, thank you both again so much for joining. I know there's a lot going on right now, especially in our world, but that's why it's so important to talk about this important subject. So thanks again. And just before we get started, I have been at Ipsos Public Affairs for about 4 months, and it's been an incredible opportunity to learn more about how we might serve a lot of other agencies. But I came immediately from government service, where I served as the Chief Experience Officer at the Department of Veterans Affairs. So public health research is not just important to me as a professional, but I also get all of my care at the VA. And it is world class, right? So it is, and it's so important to participate in some of these different projects, whether you're a veteran or you're not a veteran in other spaces. So with that, I will turn it over to Mallory Newell, who's our first presenter, and Rashi and I, don't worry, Rashi and I are just going to go off camera while she presents, and then we'll be back. So Mallory, over to you.
Great, thanks, John. All right, you can go to the next slide. All right, and we've already shown you who we are, so let's dive right into the data. Today I wanted to start and actually kind of lay out what people are concerned about and what people think about when they think of public health. So this is from our American Health Index survey that we've done with Axios, which was actually born out of multiple years of tracking around COVID. And as COVID evolved, so did this survey research to sort of take a broader look at health in a variety of ways: physical health, mental health, policies, et cetera. And here what we see is that it's fluctuated a little bit over time, but the biggest threats to public health tend to be obesity, opioids and fentanyl. We've kind of seen that rise and fall a little bit more. It's a little bit less static than some of our other trends. And then some of our newer ones that we've added in the past year, mental health issues. 1 in 5 see that as the biggest threat to American health, kind of putting it on par with obesity. And of course, as we kind of move into a new administration with new health priorities, in our last polling in December, we also added chemicals or unsafe food additives, and that's a top public health concern for just over 1 in 10 Americans. So this is to kind of set the stage of where people are at and what they think of when they think of public health. Next slide. And how do Americans feel about their own health care? Generally speaking, they're mostly happy with the ability to get good quality health care when they need it. They're a little bit less happy when it comes to out-of-pocket costs for healthcare and prescription drugs. That tends to be, probably not surprising, one of the biggest pain points when it comes to talking about people's personal health care. And again, this is sort of the American public as a whole, regardless of how they access their health care or where they have their insurance if they have it. More recently, we've kind of taken a look at some of the policy proposals that are on the table, from removing fluoride to public water supplies, to reducing requirements for testing of new drugs and therapies before they're sold to the public. But on the bottom, you can see kind of, again, this more broad view of health. The first one, 9 in 10 Americans believe that health insurance providers should cover mental health care just as much as physical health care. And 2 in 3 support insurance providers covering the cost of prescription drugs for weight loss. Again, if you kind of think back to some of the public's top concerns, right? Health and well-being, that could mean mental health for some, that could mean obesity. These policies are supported by a broad majority of the public. Anything, frankly, that relates to improving costs and expanding access to healthcare is supported by the American public. On the other hand, and I think we'll get into this more in our discussion, but kind of how public health exists to keep the American public safe and to think about sort of what's on the table right now in terms of how we shape or how the public health agencies are shaped or how they evolve. That's a little bit of a harder sell for the American public. Something timely that we know, taking this one, firing most of the research and scientific staff at the FDA and the NIH, bare majority of Americans oppose that. So when it comes to cost, we see policies receive wide support. When it comes to kind of elimination or restriction of public health agencies or safeguards that are designed to be there, we see significantly less support. Next slide. And this, I think, is really interesting. This showcases some of the research that we've done with one of our partners, NAMI, the National Alliance on Mental Illness. I want to just bring it back to mental health for a moment. I know that I'm sure Rashi can attest that this is also top of mind in the work that they do related to veterans healthcare. But how does the public feel writ large? Again, this is one of the top public health concerns right now. And most Americans, 54%, say that Congress is doing too little to address the state of mental health care in the US. Again, this is something that the public broadly feels should be treated just on par with physical health. We've seen in other studies that we've done with AARP and other partners that, bringing mental health, well-being, and wellness even into the workplace is seen as having some important benefits. And, I think kind of centering government here, what we know is that at least in this particular area, this is one where they feel that an arm of the federal government is doing too little. And we know from some of our other Ipsos polling that Americans do generally feel like it is the responsibility of the federal government to oversee and to implement, basic healthcare, whatever that means and whatever that looks like. Next slide. So obviously, with everything going on in our current landscape, we also wanted to showcase some of our newest data around how Americans feel about health agencies themselves. While most Americans, about 3 in 4, agree that they understand what purpose the FDA, the CDC serves in society, you can see that's a little bit mixed between people that strongly agree and people that somewhat agree. But I want to draw your attention to the third bar here. 77% of Americans agree that public health research positively contributes to the public interest. So again, if you think back to those policy proposals a few slides ago, we know that most Americans oppose kind of taking away some of those safeguards, of firing staff that are responsible for implementing some of this research. We also see that the American public broadly thinks that public health research and an investment positively contributes to our society as a whole. Now, here's the issue. I'm sure as we all know, our society has become increasingly polarized on a variety of issues. And when it comes to trust in public health agencies and officials, they're certainly not immune to this declining institutional or interpersonal trust. They're also not immune to this highly polarized world that we all exist in right now. From the left, you can see that the vast majority of Americans, and this is one place of strong agreement, trust information about health topics from their personal doctor. And you can also see that a majority of Americans, 3 in 5, say that they trust the CDC, the NIH, and the FDA for information on health topics. However, that broad support on the whole doesn't tell the whole story, because when you look at this through the lens of party affiliation, whether somebody identifies as a Democrat, Republican, or somebody else, you see significant gaps in trust, 40 percentage points, 50 percentage points. Republicans are significantly less likely to say that they trust these public health agencies for information on health topics, whereas a supermajority of Democrats and most independents feel that they still trust these agencies for information. You see the inverse when we ask about President Trump, our new Health and Human Services Secretary, RFK Jr., and Elon Musk, where most Republicans support them for information on health topics and very few Democrats say the same. So again, and really this public health is not any different than most other issues on the table right now. It's truly the lens of partisanship. And this also extends to media consumption a little bit in terms of who people are listening to, where they get their information from, and that informs their level of trust on this topic, as well as many others. Next slide. But finally, I wanted to end on an optimistic note, which is that most Americans think that these American health institutions, regardless of level of trust for information from them, they do feel that they should be strengthened. 72% say that the Trump administration should strengthen food safety inspections. A similar number feel the same about veterans' health care. 2 in 3 say that Medicare should be strengthened. 54% say that Medicaid should be strengthened. So there is a little bit of a gap in perception here between Medicare and Medicaid. But all of these are receive a majority support or feeling that they should be strengthened. So again, I think that's really kind of the lay of the land from the public's perspective on the issue of, one that trust factors in a lot here in terms of what we're hearing from these agencies, from these entities, But also, I think at the end of the day, there is this fundamental belief that these agencies and public health research should be strengthened and does serve a public good. So with that, I'd love to introduce Rashi Romanoff, CEO of NAVREF, and she can do a deep dive into what the work that she does for veterans healthcare and go a little bit more in depth there. Rashi, over to you.
Thank you so much, Mallory. The data that Ipsos provides on this topic is absolutely fascinating. I feel like I could have asked a million follow-up questions from your slides. And John, I'm wondering if you can actually go back to the last slide that Mallory presented, because I think it's a good segue. I loved seeing this data, and, full disclosure, I think a lot of the planning for this webinar probably started a few weeks ago, maybe even a couple months ago. And so obviously the environment that we're all thinking about, things like public health and research, has changed a lot, has been in the news a lot. But one of the things that I loved seeing about this data, and really why I'm here today, is to do a deep dive, right? So in looking at all this data sort of across public health research, there could likely be people talking specifically about the CDC, specifically about NIH, specifically about other agencies. Loved seeing this sort of support for the Veterans Health Administration. And I think this is not, while it's great to see, it's also for people that have worked in the military veteran space, not particularly surprising. One of the reasons I think I've worked in this space and stayed in this space for so long is because it's an area, I live in Washington, D.C., but it's an area that really does garner wide support, regardless of party affiliation, regardless of where you live. People really want to see a strong VA. And I think this support and this sense of service and gratitude that we have towards those who have served is so strong that wanting to provide the highest quality care and invest in research is something that is really, really strong in this military veteran space. And so really excited to think about all this data and how this sort of plays out at the VA. If you want to go forward a couple slides. So a little bit about the VA before we sort of dive into their role in public health and research. For those who don't know, the U.S. Department of Veterans Affairs is the nation's largest integrated healthcare system. It is the second largest federal agency behind the Department of Defense. It has over 1,200 sites of care, so clinics, specialty care centers, nursing homes, etc., in all 50 states and all territories. Over 400,000 employees at the VA. And I think one of the things that really transformed the VA is something that happened following World War II. So for a bit of history, after World War II, there was obviously this influx of wounded veterans returning back, and the VA was really overwhelmed. There wasn't an opportunity, there wasn't enough providers, wasn't an opportunity to sort of handle this volume of patients that was coming back from World War II. And that's really where this public-private partnership model was born. So the VA partners with academic medical centers all across the country. So as a part of most physicians or most healthcare professionals' formal education and formal training, they are likely doing some component of that training at the VA. So the famous statistic that we often say about the VA is that the VA actually trains between 70 and 75% of the nation's doctors. And so I always say this is the largest public-private partnership that I think the federal government, I always challenge people, if you know of a bigger one, let me know. But I think it's the biggest, the largest public-private partnership model that exists in the federal government. And I think what it's led to is this investment in really high quality healthcare. And you have this, huge proportion of duly appointed personnel that are working at the best academic medical centers in the country, also doing research at the VA, and that's led to so much discovery, so much innovation, and really, really high quality care across the VA. So just a couple things about the VA as we dive into public health research. You can go to the next slide. So when we say the largest integrated system, usually people are like, so what does that mean? How does that really translate? So who the VA serves? Nationwide, there are about 20 million veterans. half of them are using VA for VA benefits, and just under half are enrolled in VA healthcare. So a little over 9 million are enrolled in VA healthcare. We included some of the demographic information about male versus female, racial demographics, age demographics. What I'll say a little bit just to sort of summarize, female veterans, while you might say, oh, it's 1/10 of the population that's getting care at the VA, it's actually the fastest growing subpopulation. Believe the number is expected to triple in sort of the next 40 to 50 years. So it's really interesting when you think about an environment and an institution like the VA having to now transform to care for women veterans. I think they're doing a lot there to adapt the infrastructure to be able to do that. And this aging issue is sort of another thing that's been of real interest. So oftentimes I say the VA is it's a bit of a microcosm of what you see happening in American public health writ large, right? Because it has this breadth across all 50 states. You have folks living in rural areas and metropolitan areas. You have racial diversity. The aging issues are much like what we're seeing in American public health writ large. And so increasingly things like cancers, dementia, Alzheimer's, Parkinson's, diabetes, asthma, all the things that sort of come along, comorbidities as we all age. We see a lot of that across the VA. And then as a result, because of this integrated system, because of a single EMR, because of this relationship you have with the academics, you have this environment that's really interesting and really robust for clinical research and could really serve as a launch pad for how we think about innovating American medicine for the next decades to come. You can go to the next slide. So a little bit about what NAVREF does, our corner of the world. We represent, so we're a membership association, and we represent more than 75 VA-affiliated nonprofit foundations. So our role is to work with external organizations to bring more clinical research trial opportunities to the VA. So the easy way to say it is anytime you've heard of like an NIH trial, a PCORI trial, PCORI grant, Pfizer, Merck, Johnson & Johnson, any pharmaceutical company. Increasingly, we're seeing a lot of interest from biotechs, NIH grants, DoD grants, pretty much any money that is not VA that is being invested in VA research is likely coming through one of our VA affiliated nonprofits that NAVREF represents. So our members are the one facilitating the extramural research program. To put it in context in terms of what this looks like in the size and scope, in FY22, they facilitated a little over $300 million in clinical research and education investments across the VA. VA's research budget is around $900 million. So about $1 in $3 that the VA is spending on research is really coming from an external organization or an external entity. And I think, again, there's so much interest in this when you look at sort of the population of VA, the statistics, the number of patients you have when it comes to these chronic conditions. So it makes it an area that a lot of folks are really interested in investing funds, investing resources, and really leveraging to better understand disease progression and potential treatments. You can go to the next slide. So, why do research at the VA, and how can we think about research opportunities and public health at the VA? So beyond it being the largest integrated system with all these patients, you also have this single electronic medical record, right? So when I talk to pharmaceutical companies, or if we're talking to other organizations that are interested, being able to tell them there is a single electronic medical record with more than 9 million patients where you're able to sort of access and mine that information is incredibly interesting, right? Because when you go to the Mayo Clinic, when you go to other places, just the mere patient volume is something that is really interesting to think about. Additionally, because the VA made investments into things like telehealth services and mental health in a way that was really significant maybe 2-3 decades ago, you also have this underlying infrastructure in place to really be able to experiment and think in a creative way about how we're delivering healthcare, right? It doesn't all have to just be at the doctor's office. And VA sort of in the 90s and early aughts made these investments into telehealth so that now they sort of already have the infrastructure in place to think really creatively around how to bring mobile health and digital health technologies directly to veterans. And in many ways, this was sort of beyond and ahead of the game and ahead of the curve, the same way with the electronic medical record. a lot of people don't know this, but the VA research program has a long, long history. It's turning 100 years old this year. It was founded in 1925. My joke that I usually do when I'm in like a live audience is that it doesn't look a day over 98, but it's harder to do on a webinar, just trying to keep things a little bit light. But you know, it's been around for 100 years. So there's this proven track record of success with pioneering healthcare innovations, which we'll talk about in just a second. But I also think it's a known entity. So you know, talking to about the partnerships with academic medical centers, you know, I always say, I challenge people the next time you're at your doctor's office, if John, maybe not you since you go to the VA, but for anyone else who's just going to see a physician in their primary care office, ask them if they ever did any of their training at the VA. Chances are they will say, yes, I did some sort of training at the VA. And so it's an entity that a lot of people are familiar with, and it, because of this academic public-private partnership, it's really bred all of these really interesting moments and milestones for American public health. And then the final point that we say, and I think this is a really interesting thing, and I think we can get into this a little bit more in the discussion, but more than 60% of VA researchers are also clinicians who provide direct patient care. Because VA has a mandate to, you know, provide care, to increase access. Obviously, for those who've been following the news, maybe not the last 3 weeks, but the last few years, access has been a really, really huge priority for the VA. And so really anybody who's coming in who has credentials to treat patients, they want to make sure that treating patients and providing clinical care is the first priority. But the really beautiful sort of outcome of all of this is that when you do research at the VA, it's not research that's necessarily just for publication or that goes to sort of sit or, you know, is something that you sort of build as a body of work. It's all of those things, but in addition to it, you often see the impacts of that very quickly in how clinical care is delivered across the system. And because it's an integrated sort of closed loop system, if they figure out something is going to help see patients faster or is going to reduce hospitalizations, the ability to sort of have that replicated and have that cascade out the system is really, really exciting and makes public health there a really fascinating thing to work on. You can go to the next slide. So I won't go through all of these, but I always like to just touch upon, you know, what are some of the things that are really, really exciting that VA has accomplished? Because I think one of the things we have found, most people don't really know that much about the VA. So in looking at all of the data and preparing for this, it just got me thinking about more and more questions to start asking and to start digging into Ipsos data about, because chances are if you haven't worked at the VA, you haven't trained at the VA, you don't have a parent or a grandparent or a spouse or a child who's going to the VA for care, you might not actually be that familiar with, you know, the building that you drive by, that's the hospital that says VA here. And so there's, as a result, you know, one of the things we always try to do is talk about what does this innovation look like and what does this discovery look like? And you'll notice, you know, 1925, as we mentioned, was sort of the birth and the launch of the VA research program. So we're coming up on this 100th year. And you'll see that a lot of these major innovations happened in that sort of 1960 period and on. And a huge sort of reasoning for that is it's that direct correlation between post-World War II and the academic model of, you know, duly appointed personnel working at the VA and at academic medical centers. And so as a result of all of that, you know, they invented the implantable cardiac pacemaker, development of the CAT scan. They did the first liver transplant. The nicotine patch was famously invented at the VA. 3 Nobel Prizes, Lasker Awards. You know, just last year, I guess 2 years ago at this point, they enrolled the 1 millionth veteran into the Million Veteran Program, making it the largest and the most diverse genetic biobank in the world. So this is all just, again, snapshots of discovery and of milestone moments over the last decade, but just goes to show you that these investments in public health research and leveraging VA's network and the academic partners has really led to this very strong fabric, which is a foundation of American public health, which I think is something that a lot of people don't really talk about all that often. You can go to the next slide. So I have this in here a little bit as a call to action. So, you know, oftentimes if I'm talking particularly to audiences of, you know, industry sponsors of clinical trials or other organizations, you know, despite all of this, despite the history, despite all the great facts and figures, you know, less than 5% of clinical trials are being offered at VA medical centers. So if I can leave you with anything, is that, you know, NAVREF's role and my sort of mission in this organization is to really bring in more high quality clinical trials to the VA. All of this is about making sure veterans have access to cutting edge treatments and to new interventions. So if any of you are working in organizations or in spaces that is doing research that's sort of focused on veterans health, please don't hesitate to reach out. This is what we love to do, and really excited to continue the discussion.
Awesome. Thanks so much, Rashi. And I'm going to go ahead and stop sharing the slides so we can all see each other. But yeah, I think, you know, a lot of the data is conflicting, right? I mean, if the public, if Americans trust certain, especially their doctors, but like if they trust Medicare, if they trust other programs that that the federal government and the state government delivers on, yet there are certain agencies that have become politicized or polarized in the same amount of time or in the same discussion. You know, how might we better protect public health research writ large? I mean, we know that we're the biggest funder of public health research in the world as a country, but how can we help organizations and agencies and the centers in the field better protect and their funding and protect the studies that are so critically important to the health of Americans? So Rashi, I'll pitch it over to you first since you're still warmed up, and then we'll go over to Mallory. So after you.
Yeah, and you know, I think it's really interesting to think about just the last few weeks, how we're communicating about the value of public health research, right? And I think one of the things that was really interesting in the Ipsos data is while people value the institution, this connective thread between the institution itself and the day-to-day work of what everybody is doing is something that I think we can all do a better job of explaining, right? And so I think one of the things that, you know, whether it's the last few weeks, whether it's COVID, sort of the sort of broader lens of public health and sort of opinions and how we're thinking about how the public understands all of this, I think one of the things that is going to be really, really critical is explaining, you know, what do these investments in research tactically mean for, you know, me as a mom who's taking my kid to the doctor and is you know, getting all their vaccinations, right? And I think explaining those connective threads is really, really important and is something that we could be doing a little bit of a stronger job connecting the dots on.
Yeah, I couldn't agree more, right? I think the reason why that things have become so politicized is because in the absence of a deep understanding of what these agencies do day in, day out, we kind of resort back to taking our cues and clues from political leaders, from the media that we listen to or watch, or what we see on social media, like our own echo chambers, right? And I think if you kind of pull back and really explain and make the connection for the public what these agencies do, because again, keep in mind, our polling data shows that a strong majority believe that it's the US government, not individuals, who are responsible for ensuring food that's sold in the US is safe, ensuring that healthcare and medicines that are available for sale are safe and effective. And even just over half say that it's the government's job to ensure that all Americans have access to healthcare. So I think, again, kind of peeling back the layers, knowing what we know about what concerns are top of mind for people, right? It's healthcare access and affordability. It's things like obesity, mental health, well-being, right? There is still a sentiment that the government has a role to play for making sure that the food we eat, the water we drink, the pills that we take, and the healthcare we receive are safe. But that linkage, I think, is just not quite there yet for most.
Yeah, and I think, I mean, it's a national security concern in many ways too, right? I mean, if more people are food or water insecure, I mean, we don't have the ability to function as an economy or certainly the military wouldn't be able to function if those basic needs weren't addressed in some of the communities around our installations, which are an everyday American neighborhood. So in terms of like given especially the public opinion data around public health topics and health topics writ large, like should the nomenclature evolve like in order to better resonate with Americans so that they may not frame it in such a politicized or polarized world? I mean, just the term public health in itself is probably a bit strange to most people, I would think, because they aren't in this industry or this space, so to speak. So what do y'all think about that? I mean, you know, I know that there's been some discussion about changing like the social drivers of health and health related social needs type of nomenclature to like just wraparound services, which is essentially what they are. But public health research and the nomenclature around that, should we think about reframing it in order to better resonate with American people?
Yeah, I mean, I would love to be able to do research on research, right? That's one area where we haven't touched on a great deal, but just kind of getting a better understanding of what Americans actually know, like their true knowledge about what these agencies do. Because I think we're seeing that unfold in real time, right? We know from our own data that kind of on right, in theory, excuse me, a majority say that they support downsizing the federal government. But when you lay out what that looks like and what that means with specific policy proposals and things that are happening that are actually an extension of doing that, support declines. And we also know that, you know, if you present people with a forced choice, like cut federal government spending by $2 trillion versus increasing food safety inspections and restrictions on food additives, that's actually a choice that we've presented people in our Axios Ipsos polling. A majority support the latter, you know, increasing safety inspections and restrictions on food additives. So I think for me, the connection still has to be sort of twofold. One, how can we better convey to the American public that these agencies are nonpartisan and working to make sure that, again, things are safe, effective, and affordable, right? We also know that the main issue facing the country right now and for the past 2 years has been the economy. And so I think kind of connecting that sort of level of knowledge, increasing that level of knowledge with very simple explanations of like what they actually do for people, right? For their pocketbooks, for their well-being, for their safety. I think that's probably the key here. But unfortunately, we haven't done a lot of research around what people know about public health research yet.
Yeah. And I'll say this to be a bit more provocative, because I used to work in the social determinants of health space, and sometimes I think we get caught up in what things are called in a way that is, I don't want to say is a distraction, but to your point, John, you know, social determinants of health, for a while it was equity, for a while it was wraparound services. Before then, it was just things that a social worker did, right? Like we kind of change the name on it a lot, and sometimes I think we almost becomes a distraction, as opposed to like, okay, we've now renamed it 7 times, but has housing really gotten any better? Like we've renamed it 7 times, but have we figured out some workable solutions to food insecurity? So sometimes the naming stuff, I think we might overthink at times. But I think, Mallory, you really hit it on the head, where it's not so much the naming, but it's the like, well, what is the value of this, right? And I think one of the things, and I know Ipsos was critical in this with the Million Veteran Program, because I think you guys did a lot of the surveying. You know, in addition to getting, you know, everyone's blood samples, I think one of the things that makes the Million Veteran Program such a rich and robust data set is that coupled with that is this comprehensive data survey that the Ipsos team led. And I think when you really ask people, like, what is your motivation for participating in research, or what is your motivation for wanting to get involved? It tends to be about right? Helping my community, helping my kids, you know, making sure that I'm feeding healthy food to my children or to the people I'm taking care of. And so I think the motivations about why people seek out information and I love seeing the data about who they trust. It's great to see that people trust their physicians. So that almost seems more important than the like, well, what's the name of the deck, right? It's the, well, why are people making the decisions where they're making, and how are we incentivizing things like healthy food and going to the gym and things like that?
Not to mention that sometimes naming can be polarizing, right?
Yeah. And that's, I think that's I mean, that's kind of what I was leaning into a little bit, is like, you know, how might we better resonate and take a lot of these insights and put them into action? You know, if we have all this great public opinion data that we're collecting about healthcare writ large, like how might we use them to better influence and promote the sheer importance of public health research and the monetary return on investment that it does or could provide our infrastructure? We do have a question from the chat, and I want to thank Michael Hartford in advance for submitting. Good to see you there, sir. So Michael asks, our GDP spend in America, I'm assuming, is twice as much per person on health. The data suggests the majority of those surveyed overwhelmingly agree our healthcare system needs to be overhauled. How is your data being used to affect changes in our healthcare system? And how can AI be used to obtain more comprehensive data almost instantaneously? So I'll pitch it over to you two first, and then I might have a go at it as well if we have enough time. So over to you all.
Yeah, I can jump in first. I think it's a great question, right? And again, I think this is why we do need to connect the value of public health to cost, right? Because fundamentally, we saw this in the 2024 presidential election. Americans still see the economy as the biggest issue to deal with, and they're still concerned about the cost of their food, their gas, price of eggs, right? But also their healthcare. I showed that earlier in the presentation. So that certainly is something that I think is top of mind. How are we utilizing this information? Well, one, I think, you know, by sharing this data publicly, we hope that agencies and folks in this space can better understand what the American public thinks and feels, and hopefully create some conversations and perhaps affect change, or at least see where there are some knowledge gaps, right? You know, that's why I do what I do. Our president, Cliff Young, says our polling is, you know, giving voice to people. And I think this research is no exception. Question on AI is interesting, though, because we also know from some of our research that people get a little hesitant when it comes to the involvement of AI in their personal health care. I think there's still some safety concerns, still wanting that sort of personal interaction, at least when it comes to like how they go to their doctor, right? They have a lot of trust in their personal doctor. They want to see a human. But I think there's certainly a lot more that we can learn and understand there as AI continues to develop in a number of ways.
Yeah, I think, you know, my answer on sort of the spend rates, you know, I think one of the things, you know, I think we take care of disease very well in the United States. And it's very, you know, when you think of chronic disease management and, you know, all the options you have around diabetes, if you were just to Google right now, like diabetes treatments, you know, you'd be inundated with different drugs, with different regimens, with different trials. I think one of the things, sort of from the public health angle, is investing in disease prevention, right? Because the best way to have an affordable diabetes strategy is to not contract diabetes in the first place, right? So I think, again, kind of getting to the incentives and the motivations around how are we incentivizing folks to make healthier decisions, and whether that's, you know, payment reform, whether that's benefit structure. I think there's been a lot of really interesting work done in that space, trying to connect all of those dots and make it easier, I think, for folks to engage in healthy behaviors. You know, AI, I think, is really interesting. I'm definitely not in the camp that I think it will solve all of the world's problems, but at the same time, I do think what's really exciting to me is, and sort of coupling it with the data that you showed, you know, thinking about how busy providers are and that they're the person that a patient trusts the most. If you can create tools that makes it possible for them to have 5 more minutes with that patient because they're not transcribing notes, and maybe it's something that's doing an AI recording and doing that automatically. That to me is a win. I think there's also, beyond all of the really like high tech, digital genetic, like what are we doing with all this PII and different algorithms? I think there's also just like basic workforce office management tasks that when you talk to people that work in healthcare every day, they're just going through their day of how much is just manual entry. That those kinds of areas, I think when we think about AI applications or large language models, or where to place a grocery store so that as many people as possible have access to healthy foods, like thinking about technology for this like convenience and sort of opportunities for making it easier for people to engage in productive healthcare discussions and good healthy behaviors is where I get really excited about the technology.
And I'll just do a quick plug for, a lot of the data we collect is, yes, it's public opinion. It's a lot of the incredible, useful information that Mallory shared as well, but we do a lot of social science and patient experience measurement here at Ipsos in particular, but that's my background, especially when I served in the government. And you can correlate patient experience data and like the better capture of that, and then how you treat your employees, how you train your employees and clinicians to better interact with the patients, and then measuring their experiences longitudinally and looking at the free text comments to improve the process and reduce the administrative burden and get them to clinic, get them to a well system and not a sick system, I think is what Rashi is leading into. That's shown to lead to better patient outcomes and reduce costs, drive efficiency, and really mirror the private sector. Although there are government agencies and healthcare experiences within the federal government, like the Department of Veterans Affairs, that far eclipse private sector patient experiences. So I think that there's a lot to be said for the adequate measurement of those experiences, and then improving the processes that correspond with their healthcare outcomes. And just to make a final point, I know we're running close to overtime, or we are over time now, but I really appreciate you all being with us. Is the Million Veteran Program that Rashi mentioned. I mean, it is such a powerful tool to be able to conduct that type of public health and genetic research on such a huge population of Americans that span the gamut in terms of age, in terms of ethnicity and gender, et cetera. And, Ipsos being so proud to be such an incredible part of that project, and wanting to do a lot more public health research for a lot of the centers and partners out in the field as well. So just really excited to talk a lot more about this, especially because of the data that Mallory presented and the expert commentary that both she and Rashi provided on this important topic, and of course, the wonderful mission that NAVREF executes every day in helping promote and extend and expand research at the Department of Veterans Affairs and beyond. So, well, thank you all so much for joining. Thank you, Mallory. Thank you, Rashi, for being on the panel with me. And Ellen, I will turn it back over to you.
Wow, I just really want to thank our speakers today, Rashi, Mallory, and John, for today's amazing discussion. And thank you all for joining us. If we didn't get to your question, we will do so by email. And also in your email, you will receive a direct link to today's recorded presentation in the next few days. That now concludes today's amazing webinar. Have a wonderful day, everyone.
Thanks.